Facebook people. Dr. Sam and Dr. Emma here.
Good afternoon.
Can we have some signs of life? We've never done this before, so if you're there, say hello. I know you're here. I know I'm here. Yeah?
That's good.
So we are doing a session today, our first ever Facebook Live session, so thank you for joining me on a busy Friday, to talk about acne for Acne Awareness Month this month.
It's a great place to start the weekend, isn't it, about how to sort out your skin. So we've got some good questions from Instagram, which we're going to try and answer first, and then keep your questions coming in so that we can do it on the spot, and you've got us completely...
Sorry. Okay, so let's kick off with some questions. Thank you all for getting involved so soon. Let's kick off with an easy one for you, Dr. Emma. How to treat an angry red spot, especially if you have a big event coming up.
Yeah, which always happens.
Yeah.
So my mainstay of treatment for an acute spot is benzoyl peroxide. So I think if you feel, and often you can feel that something's coming up the day before, so a little lump, something that's a little bit red, bit of benzoyl peroxide just in that sort of area, and keep doing that every day until it starts to settle down. Don't try and do it multiple times a day, because then you'll end up with an irritant reaction and you won't
get hole. Yeah.
Exactly, and you won't get any significant benefit. So a bit of benzoyl peroxide and then a great concealer as well. So you know what I'm going to say, our basic Vichy Derma blend, which is great for covering things up.
Yeah, foundation stick I think best, generally because it's dry and really stays put. Or I quite like the new NARS Complete Matte Concealer for an acute horrendoma.
What do you think of some of the 3D concealers with a bit of dimethicone in them?
I mean, in general, dimethicone works quite nicely, especially if you have used a spot cream and are prone to getting that sort of eczema type change on the edges. And what I've started doing, certainly myself, if I've got a really bad spot, but it's in maybe quite a delicate part of my face, I will get a Q-tip with moisturiser on it and like wipe off the edge of the spot cream, so it's not sitting there on completely normal looking skin. I just think it tends to reduce the irritancy a bit, so that works for me. And
some of the ones like there's an Effaclar BB cream, which has got a little bit on, which also can work quite well underneath, but then a bit of foundation on the top. So
I've never been a huge fan of medicated bases.
It's not medicated. It's not the salicylic acid.
No, but I don't really like them. Do you? I just find they make me dry and a bit peely all over, and I really am an advocate of like localized treatment for a blemish. You?
Yep.
Yeah. Okay. Good. Hope that was helpful. Next one, a lady who's 41 and post-roaccutane, who's got anti-aging concerns. Quite happy with her skin now, but just wants to minimise wrinkles.
Perfect. So you want to get back on the retinoids, the topical retinoids, so something like tretinoin, or even something like differin, but probably if you want to go more for the anti-aging purposes, I go for tretinoin. Definitely. And it'd be a great thing to improve the appearance of fine lines. I know you're post-roaccutane and your skin is doing really, really well, but there is some evidence that actually if you keep going with creams and topical retinoids, that you can reduce the risk of your skin relapsing after. So it's a no-brainer. Completely,
and it's good for pore clarity and keeping pores taut and minimal size, because collagen production is important for making your pores sort of stand up and be perky.
Perky pores.
Perky pores, like that. Right, let's see what else we had. Seems to me like sunscreen makes matters worse with my acne. How do I avoid that? Now, I mean, I think we talked about sunscreen, I think, till the cows come home on YouTube, but choosing the right sunscreen is vital, because A, the sun will make you break out because it makes you more prone to comedone formation. So do not think because it gives you a little bit of temporary relief from the red blemishes that it's actually doing you good for your acne. It's not. So you do need sunscreen as part of your general skincare routine, especially if you're using acne medications like retinoids, benzoyl peroxide, etc. So the key is to look for the term non-comedogenic, which means non-clogging, and at the lower end you can go the Roche Posay and Spironolactone. Heliocare is not too expensive. Bioderma, those are good, reasonably priced brands, a little bit more cosmetically elegant and physical filter based. Think Neostrata, Gian Marini, or our personal favourite Elta MD. Any other thoughts about sunscreen?
Yeah, I think the key thing to think is that not all sunscreens are created equal. And I think a lot of people will say, oh, I'm using SPF 50, and not all of them exactly the same. There's so many other aspects to sun protection. There's so many other aspects to the base that they have. So they're really not created equal. So if you're finding one that breaks you out, don't think that it's just all sunscreens.
Yeah, that's very true.
Just think carefully about the one that you're choosing.
And I think it is worth pursuing the one that you actually almost enjoy using. And I have to say that for me, Ulta ND UV Clear has been a game changer, both for me and for patients. They all report back, I enjoy using sunscreen for the first time. This is not, we don't have any working relationship with Ulta ND, it's just genuinely a really lovely product to use, which facilitates using the correct amount. The single commonest reason why sunscreen fails you is because you haven't put enough on and you don't reapply it. So find one that you actually think this is a nice skincare product and you forget that it's a sunscreen.
We're going to come back to acne now because we could just go on a tangent to do a sunscreen because, as I'm sure you know, we're passionate about sun protection and sunscreen. But we're back on acne now, don't worry.
Okay, so how about this one? I've cleared my active hormonal acne but still have some stubborn closed comedones on my forehead and jawline. What would you recommend? What do you think? I think there's only two topicals that really work for comedone formation. That's your retinoid, and then the other one is azelaic acid. And I think that oftentimes if your skin is quite robust, you can tolerate both. And of course, there are lots of different retinoids. So if someone's on a gentler one and they've still got those little stubborn clogs, I'll just push up the potency and the quantity that they use, and also strip back their routine to make sure nothing else that they're using is actively contributing to new comedone formation. What about you?
Yeah, I agree. I do think sometimes benzoyl peroxide in combination with a retinoid can be helpful.
Yeah.
Difficult to get in, difficult to establish in the first few weeks, I think. So I think that's a better way to go in terms of azelaic acid retinoid, or retinoid just by itself at first. But I find sometimes if we're just not winning, a burst bit of benzoyl peroxide along with the retinoid can actually be really helpful for that. So.
Yeah. And I think that for someone who's still got ongoing active acne despite those topicals, then oral medications, things that affect the male hormone sort of responsiveness of the skin will help as well. So that's certain types of contraceptive pills and even oral medications like spironolactone or Roacctuane. So definitely a conversation to have with a dermatologist if you're still struggling despite a proper prescription grade skincare regime.
Closed comedones can actually be very, very tenacious and very sticky.
Right.
And I think sometimes as well, closed comedones, when you start a regime, can really mean that actually it's going to take quite a while to actually change things and can sometimes be quite troublesome at first.
And you can draw them out, can't you, with retinoids? The first 6 weeks, I think it's definitely sort of like a conveyor belt process in the pore where you actually almost bring to the surface the crud that was sitting underneath. It's so nice. But yeah, people do, especially on Roacctuane, you get a significant purge, so it's not that surprising you get it with topicals as well. What do you think about niacinamide? We had a question about someone who is very sensitive and eczema-prone, who was really struggling and had been told by a dermatologist that there was no actives that were suitable for their skin. You do a lot of dry skin work.
And I have to say, when anyone with dry skin and eczema comes into me, I think that there is a way to get them established on actives. I think you have to first of all be really careful about settling down all the dryness and looking really to the cause of the dryness. So if there's active eczema and things like that, you have to settle all of that down, and it may be that you have to pulse in a little bit of treatment for the eczema every twice a week or something whilst you're using the actives. But I haven't had many people that absolutely will not tolerate any actives if it's established properly and if the underlying condition is settled down. So I have to say I don't use that much niacinamide. I think it can be helpful as part of a multi sort of faceted skincare regime, but as monotherapy, I'm not
doesn't do a huge amount on its own.
Not massive. I think the other thing I'm really careful about with people who have dry skin and eczema is making sure that actually everything else is stripped back so that you don't impede your introduction of something that's really going to work. And I think that's so key. So anything like salicylic acid, AHAs, BHAs, all of that just completely strip out. And I haven't had many people that I can't add in any actives with.
No, I think that's very true. So I think, pare it back, get rid of, and I think a really good supportive regime, I find Aven to be a really good brand for the basics whenever someone's got a real dry skin issue. Recovery cream's an awesome moisturiser, doesn't clog you up and really supportive. And then introducing actives one at a time, something like different, I think you can get most people using. Sometimes applying the active over the top of a moisturiser rather than directly onto cleansed skin can make a big difference. Yeah, absolutely. So there are lots of little ways you can tweak the basics, to customize them for someone's skin type. And I think it may just be that you need someone who pays a little bit more attention to the detail of those nuances of your particular skin type. But I think there is something that will work for you. Azelaic acid is often quite well tolerated if handled correctly, less frequently at the beginning, and then building up to increased frequency and quantities as you get more tolerant.
I think the other thing is, and sometimes I use orals to settle down inflammation as well. Exactly. So I think there are lots of different tricks that you can do. And like I said, I can't think of anybody that I just haven't been able to use any topical anti-acne products with because of their eczemas. And I see a lot of people with quite significant eczema.
And I think choosing eczema treatment, for example, the calcineurin inhibitors that don't tend to antagonize the acne, I think that's also quite important as well. See a lot of seborrheic eczema in conjunction of acne and rosacea, which, you know, sometimes you see all three together, and you really have to choose your actives carefully to ensure that one treatment for one condition doesn't antagonize the other two. We can get there usually.
Yeah.
I'm so hot. Are you hot? Really hot today. Anyway, now let's see. We've got one comment. How do we read our comments? Celia. We've got our lovely Celia here. Oh, hello, Fennel. Fennel, I hope that's how you say your name. We're glad to see you. Do you have any questions for us? Please share. So let's keep going with the questions from Instagram. So, the best and most effective way to even out the skin tone after acne. So lots of different things you can use.
I think the first thing to be aware of is what exactly is the problem with the skin tone. So is it redness? Is it pigmentation? Is it the contour, i.e. is the surface of the skin not entirely smooth? And I think those three things have completely different solutions. And we've talked a lot about this on our videos, about trying to work out exactly what it is you're treating, because they all have different treatments. And there isn't one complete panacea for all of those sorts of issues. So I think it's really important to think about it.
Yeah. And I think that the good news is a lot of your good acne medications will also start to work on the pigmentation marks anyway. But for me, the goal is always switch off the new breakouts so we're not accumulating more damage. And then I try to get as much out of the nighttime retinoid part of the routine, assuming someone's on a retinoid, they're not pregnant. Because then you sort of free up, I think you're freeing up your morning time routine to start to work more specifically on the pigmentation. And you can choose acne ingredients like azelaic acid, which are also good for pigmentation. Or you can go, I don't know, down the Obagi Nuderm route, which I find really does get the most even skin tone of any of the topicals. So all the hard work's being done by the retinoid at night to keep the acne at bay, and then you can start to really work on evenness of skin tone in the morning.
And that's hydroquinone based.
Yeah, hydroquinone. So it has to be done under guidance of somebody who knows what they're doing and has experience. But that combined with vitamin C and alpha hydroxy acids and proper sunscreen, I find really does often surprisingly good results, and there's no need for, you know, more aggressive treatments like peels and lasers. Although someone may decide they want that route to work for them, but then oftentimes you have to interrupt your retinoid use. So I think there's a lot to be said for the slow, steady route where you've got control over it yourself with using topicals.
I would say over 50% of people, so maybe 75% of people who come in and ask about acne scarring, by the time their treatment's settled and they're on regimes, they don't want to do anything.
They're not that worried about it. It's so true. So, and bear in mind, up to 35% of your acne scars, and we actually mean scars, will spontaneously resolve over the course of a couple of years. So, again, perhaps less common with the more stubborn, deep-seated sort of scars, like ice pick scars and things. But, you know, get your acne controlled, sort out the pigmentation, and then reassess. It's amazing what degree of improvement you can get with time, patience, and just mental clearing of your worries about acne. Now we've got a question from Tamara Leona. My daughter started taking zinc supplements and says it's been transformational for her acne. Zinc is used a lot in France particularly, and we certainly have used it for some time in the topical format, in the form of Zinnerate. I mean, I recommend zinc supplements certainly as an adjunct for all my patients to make sure they're getting plenty of zinc in their diet. I tend to recommend foodstuffs where possible. So for me, almonds are a really good source of zinc, and I think the bioavailability of nutrients is better from food than it is from supplements. But great that your daughter's had a good result.
Fantastic. Zinc's been used in lots of different skin conditions with variable sort of results. I agree with you. Oral zinc is sometimes quite difficult to absorb and also quite difficult to tolerate as well. So if you can get it from foods, that's amazing. But fabulous.
Shellfish, oysters, high in zinc. It's not a daily
Not,
food you're
not
going to consume.
really, but you know, take
Cashews and oysters. There's a dish someone can construct a recipe for. Okay, so that's good. Now, how long after taking Roaccutane can you have laser hair removal?
6 months.
I say 6
Everything
months for
6
all
months.
lasers. There's no rush. We know that Roaccutane does potentially contribute to impaired healing after a course. And I think given that oftentimes excess facial hair is along the jawline where we know that healing is often a bit fraught anyway, prone to lumpy scars on the jawline, why take any chances? Thread, do something else. There are lots of different hair removal modalities. Epilate, I've been recommending epilation a lot more recently. Epilators have got a lot better. Not great if you have huge, large quantities of hair, but for sort of single strays, it's just a bit annoying. I quite like it, yeah.
I think there is no point in taking a chance. The sort of Roaccutane healing thing is a little bit difficult to really, I think, to understand the evidence and whatever else. But I absolutely agree. For any cosmetic procedure, I advise wait 6 months because you want the best possible result.
Yeah. Now we've got some more questions. So, which azelaic acid products would you recommend? I mean, azelaic acid is not so widely available over the counter. Certainly the best products I've come across over the counter are the Paula's Choice ones. And also the Sesderma brand, which is a Spanish cosmeceutical brand. Often in combination with other ingredients, and therefore can be a little bit irritating. But those are two options to try over the counter. I have to say, I find it easiest to use prescription grade because these products are quite clean. And by that I mean they have the active azelaic acid in at a defined percentage and very little else. And so I can quantify someone's response or their risk of irritancy because there's not much else in there that will cause trouble. What about you?
Completely agree. Sometimes you do see azelaic acid as part of a number of different things, but it's right at the end of the ingredients, and you're thinking, really, how much of there is that? And if you don't tolerate it, you don't know, is it the azelaic acid, is it something else? So I agree, there are a couple of over-the-counter cosmeceuticals that can be helpful, but personally, once people start to get to us, I tend to advise the prescriptions.
Absolutely. Now, I have corporosa sensitive. So I assume somebody who's redness prone, yes, and super thin skin, struggling to use anti-acne products, AHA, BHA, and retinols. My skin gets very red, and it's very hard to know what's the best for me. So I think we kind of touched on this before. First things first, sort out your basics, your cleanser, your moisturiser, and your SPF. I would say do that for 2 weeks. Make sure your skin is stable, comfortable, and not dry. And then you need to drip feed in one active at a time. And something like niacinamide, if you're super, super sensitive, mightn't be a bad route to start with because it boosts barrier function through ceramide production. And it will make you more tolerant of a gentle retinoid further downstream. And do things 3 times a week for 2 weeks. If that's okay, every other night. If that's okay, after 2 weeks, nightly. And so on. So you're building a routine up over the course of months, not days or even weeks. For me, that's the best route for someone with very sensitive skin.
Yeah, I think I would also question if you have got quite significant redness or that's your problem, why you are using AHAs and BHAs, because actually I don't find them very helpful in that sort of condition. So actually working out perhaps why you're red, what the basis of that is, and what you want to achieve with your skincare regime. Because sometimes we're just bombarded with all these sorts of products which we're told are good for our skin or good for anti-aging, but actually if you've got redness-prone skin, they're probably not great for you. So I just question whether those are the right products for someone who is prone to redness.
So I think in those instances, if there is any doubt about what the trigger for your redness is, it's worth getting an expert opinion to help you put a routine together in a structured way. Now, let's see. I've started a retinol, but is there anything additional you recommend for dark circles or bags under your eyes? Thank you for the love, Sarah. What do you think?
Yeah, bags under the eyes. I mean, this is an issue close to my heart, and definitely can be a difficult one. So retinoids are great. Sometimes they're difficult to tolerate around the eyes. That's the last area I tend to add them into. Make sure you're putting lots of moisturiser around the eyes first of all. It will diffuse up a couple of centimetres, but just make sure you're protecting your eye area because dry skin around the eyes always makes everything look 10 times worse.
Yes, all those fine lines just pop out.
Vitamin C based.
I was just going to say, I think for me that's the easiest to tolerate, potent active, that's got a bit of punch and definitely has a brightening effect wherever you put it.
Definitely. And great for protection because this is probably one of the first areas to show signs of aging. So, and you really want to protect that area. Sunscreen, make sure you're doing your sunscreen. Darker pigmentation, anything any sort of pigmentation will be made worse by the sun, so make sure you are putting your sunscreen on in that sort of area. And then see how you go, add that in for a few months, and then see where you go from there.
I think dark circles in the right, because I think dark circles have lots of different causes. It can be due to the skin just simply thinning. It can be because you're irritated and you're rubbing and that's making pigment drop in the skin. It can be just part of your ethnicity. I think some people are prone to sluggish circulation, which kind of encourages hemosiderin deposition. And that group, sometimes vitamin K around the eyes can help. So we have one eye product for that called Chernarexo that we sometimes recommend. So make sure you know what the cause is, and if it's something that's addressable, then look into it. But otherwise, keeping the skin thick is key. So sunscreen, I do like niacinamide around the eyes actually, and both the Elta MD and CeraVe sunscreens contain niacinamide. So that's a good excuse to take your sunscreen up to the lash line, which people are quite reluctant to, because it does tend to settle into lines a little bit. But I think if you can convince yourself you've got an anti-aging ingredient in there too.
I think often it's very irritant, so particularly in the predominantly chemical sunscreens, around the eyes can be really, really irritant. But actually for things like Elta MD, which contain high concentrations of physical block, it's not as irritant, and I think that's the key. Often you put it around your eyes and it makes your eyes water and your makeup comes off, and that's another reason why people avoid their eye area, I think. Yeah,
and then get the sunglasses on at the nearest hint of sunshine. Right, loads of questions coming in now. How often should you use an AHA when you're using vitamin C in the AM and Tretinoin in the PM?
So, get well established on your vitamin C and your tretinoin first, because they are still going to have quite
they trump AHAs.
They do trump AHAs. So I'd get fully established on there. If you're still finding you're a little bit oily and you can tolerate more, then slowly add in your AHA twice a week first of all. Do that for a couple of weeks, then up it. Some people are truly very oily and they can tolerate it and need it every day, but I think they are in the minority. So I'd get fully established on tretinoin daily first of all, vitamin C daily, and then slowly phase in your AHA.
Completely, I agree. Now let me see. Been on accutane before, it cured me completely, but I had an Indian head massage where grapeseed oil put me over me that broke me out and still suffering 2 years on. Well, I think it's unlikely the grapeseed oil has kept your acne going, but certainly I'm not an advocate of oils really in any shape or form. I mean, if I go for a massage, I'm controlling. Do not put anything with fragrance on.
That's why I'm slightly laughing. Every time we go away to some sort of spa, there's a list of instructions to the poor people, and they shake their head. They hope we're not coming to their spas. I mean, spas around the world are just visiting them, because this one has a list as long as.
I'm like Mariah Carey for spas. No, I'm joking. So yeah, I stay well away from oils just because I'm acne prone and I'm feeling a sensitive, delicate flower these days. So, but in terms of your acne coming back, unfortunately, people do relapse after Accutane, don't they?
They do, and I think it's multifactorial. It may have been the trigger, and then actually the tendency within you may have propagated it, and maybe various different things. But the really important thing is now where to go in terms of that sort of process. Avoid any oils in your current sort of regime. Make sure you're taking stock of what you're using. Make sure it's all non-comedogenic. And then if you have had acne, particularly if it sounds like it's been really reasonably severe in the past, you need to go and have a chat about further options. Make sure you're on your topicals, because sometimes people think, well, I've been on Roacctuane in the past. What's the point of even trying creams? And actually there is a lot of point, because sometimes when acne comes back after Roacctuane, it's not quite the same. It is more responsive to other sorts of treatments, because remember, you've changed your sebaceous glands a little bit. So definitely get back on thinking about treatments, topicals. Even I know oral antibiotics are not a long-term cure, but sometimes they can just reset things a little bit while you're getting established on your topicals. And then maybe think about other hormonal matters. Anti-androgens are useful for people who've had multiple courses of Roaccutane in the past. So.
Yeah, and I think oftentimes we see a group of women in the clinic who've had Roaccutane before and have not had a great outcome. And actually they do brilliantly on this drug called Spironolactone. It's kind of a bit of a dermatology secret weapon. And it's often really good in women who are aware.
We lost you for a moment, but we're pleased to see you back.
Central London Wi-Fi. Who were controlled well by the pill, but maybe they're in their 30s or 40s, and the GP is now a bit concerned about keeping them on combined contraceptive pills. Ad infinitum. So spironolactone can often be quite a good drug in that situation.
How many times do you see that though? I mean, I literally people come in and they say, well, I was completely fine, and then I went on the pill, and I've been on the pill for 10 years, and now I decided it's time to have a break, and now my skin's been terrible. How many times do you see that? So
Daily.
much.
Yeah,
Daily.
No, it's such a common scenario. And it's very common around, brides. They come off the pill once they get married, they're thinking about having a child, and all the focus was on making the skin amazing for the big day, and then they stop the pill, and then...
It's really, really common. We see it a lot.
Yeah. Okay, we've dealt with, I think, the occasional breakout, 1 to 2% salicylic acid or benzoyl peroxide, not like about 2.5%. That for me those are the best reactive ingredients. But of course, if you're getting even vaguely frequent breakouts just before your period or whatever, you do warrant being on a topical retinoid, and that will generally limit the number of new breakouts you get if it's the right strength for your skin. Best vitamin C products. What do you like, Dr. Emma?
I like the Abaji.
Yep.
I like the fairly simple pared back ones. I like to have mainly vitamin C in my product and not multiple other different things, because again, if you're trying to have a regime that's got multiple different steps, you don't want to complicate things. So I like the Abaji brands a lot. I like the Serum 10 by SkinCeuticals, although it's only in a 10% strength, but I do like that product. What about you?
Much the same, really. I like companies that have gone to the bother of doing proper research on the product that you're actually buying. So it's not just data extrapolated from some clinical study done on some other preparation, because we know vitamin C is fragile, and if it's not in the right kind of bottle and it's not kind of in the right sort of format, it will either won't work or it will degrade in a matter of hours once it's open. So for that reason, SkinCeuticals and Abaji get my vote.
I think this is something that I talk to people a lot about in terms of what can you save on and what can't you save on. And to my mind, actually formulating a decent vitamin C serum just costs money. Like, there's no way out of that, really. And so it is worth spending money on that.
I agree. Vitamin C and sunscreen are definitely both a relative splurge to find something that will be effective and sunscreen safe, tolerable for everyday use.
And with good technology, because again, SPF 50 blanketly is not the right thing. So actually trying to protect against all of the different aspects of the sun's rays that cause allergies to the skin, and that technology costs money. So yeah, exactly. Whereas things like your cleanser, which you just wash off, or your moisturiser, that may be where you're able to make more savings.
Completely agree. Now, how safe are accutane and spironolactone? It's a big question, I think you have to, in every situation in medicine, it's about weighing up the pros and cons. We always do a risk-benefit analysis, what the downside of the condition left untreated or treated with less effective measures are versus the impact of the medications. It's all about tailoring your medication, whether it's topical or oral, to the individual.
I mean, we talk about them a lot, and we don't talk about them glibly because we don't prescribe them willy-nilly by any means. But sometimes, by the time people get to a dermatologist, they are so distressed about it. I have lots and lots of different patients who really feel they can't go out, they can't maintain their social life, their relationships are affected, their quality of life is rock bottom. And it's at that point that you
take
start
days
to
off
think,
sick, because they're so, please don't look at me, I can't face the world with my face like this.
and this is not uncommon. So it's not uncommon for us to see patients with this level of distress. And then at that sort of point, you do have to offer other things. So I think as long as you're I think they can be very safe. There are clearly potential side effects, but overall they can be clearly safe. And you, as you were saying, you basically just balance it for every single individual, because each individual's risk is very different. But we do take it very, very seriously.
I think we're probably quite lucky in that in this setting, in our clinic in Harley Street, we have probably quite an informed patient. They've found us by doing quite a lot of research usually, and probably have already tried quite a lot of things, and they already maybe have ideas about what they do and don't want to do, because there is so much information on forums. Not all of it great, but information is much more accessible now than it used to be on oral treatments. So I think I treat every patient anew, afresh. I don't have any preconceived ideas. I think there's always the objective situation, which is the level of severity of the acne and the impact it's having on the skin. And then there's the individual and how they're bothered by it. So you give them your opinion, they give you theirs, and then you find a Venn diagram, happy middle ground.
And I think that's what increasing doctors are about, and that's certainly what we're here to do. We're here to really give the very sort of balanced medical view and then take into account what people think and what their individual needs are and our recommendations. And it is this very sort of mutual decision about what we want to do. But it can be used. I think that the bottom line is they can be used very safely, but they obviously do have considerations that we always take into account.
Yeah. Cool. Right. What else have we got? Do we think the Revlite laser is effective post-acne hyperpigmentation? I think there are lots of different ways to treat a post-inflammatory hyperpigmentation. There's the quicker route with lasers. There's the slower route with creams. There are peels. So there's no one superior method to another, because I think that the upside with creams are that they keep your acne under control at the same time as also tackling the pigmentation. Laser upside might be that the result is quicker. You have to decide on the route that works best for you. I think laser is often quite a lot more expensive. So pros and cons with each methodology. So do your research. A website like Real Self is a great place to sort of start and explore what the different options are for treating pigmentation. But cosmetic things do usually have multiple different routes, and it's about tailoring the choice to the individual.
And the risk as well. So
yeah.
Unfortunately, devices sometimes are not without risk, and particularly say for darker skins. I've had quite a lot of patients who have had some downsides of lasers. So yeah. I think I also again balance each individual risk before I sort of make recommendations. But start simple. What have you got to lose?
Exactly.
I know people are quite keen to jump on and get on with devices and things, but actually taking time out to use a really good trial of cream for 3 to 6 months may save you a lot of time and money.
Okay, so someone's asked me about, hi Ashley, now that your beloved La Roche Posay Physiological cleanser is gone, have we found a holy grail replacement?
Have you got over that yet? That's the key. That's the question.
I really haven't. No. There's a story coming there, so watch this space. At the minute, we are recommending Effaclar H Hydrating Cleansing Cream, at least I am, in its place, and I think it's a reasonably good alternative. But yeah, it's a bit of a loss, I'm not going to lie.
I think there are good alternatives. You know, I think it is very much about your skin. So for super sensitive people, I may advise the Tolerian Derma Cleanser. Some of the Aven ones I like.
Rumor has it Extremely Gentle Cleanser has been discontinued. I'm not joking you. I went to order some the other day.
This is breaking news.
I'm happy to be corrected, but that's what Wigmore Pharmacy told us.
Yeah. I mean, it's interesting, isn't it? They are seeming to go more for cream cleansers, because it's all the gel ones that seem to have been discontinued more recently. I quite like the foams. I mean, some of them are a little bit drying. I think we've got enough, really, that we can use. Yeah.
Anyway, so yes, the answer, have I found the Holy Grail replacement? I don't think so, but I like the La Roche one. Now, someone says they've been using Tretinoin for about 5 months, not seen any decrease in hyperpigmentation. Well,
and that's not 100% surprising. It doesn't mean that you're not going to see it. It may be you need another agent. So depending on what type of pigmentation you have, you may need a bit of hydroquinone or azelaic acid, something like that may be helpful. So tretinoin by itself does have an effect against pigmentation, but for that really deep pigmentation, particularly for melasma and things like that, it's not the best treatment as monotherapy by itself. So you need to go along and have a chat to your derm and see what else you can add in.
And have a look at your sunscreen and make sure it's as effective as it can be. I prefer physical filters in people who are prone to hyperpigmentation. I think they give you broader UVA protection. So just have a look and make sure that you're using your sunscreen properly. Plenty of it. Maybe employ a hat, you know, wherever you are inside. No, it's underused.
Hats are so useful.
Yeah, I know.
Forehead, I mean, it basically means that your forehead is completely protected, and particularly for melasma, which very commonly can occur around there. It's brilliant. So underutilised, and there are some really good products out there.
Yeah.
And so,
yeah. Okay. What else? Anything on the horizon to treat acne scarring? I mean, there are lots of things. I mean, I think acne scarring is tough. It's not a one-size-fits-all type approach. I think we've got good lasers. I think peels help. Medical needling helps. I think you can treat scars on an individual basis with surgery and fillers. But I think what's important to understand is that scarring is, even oral antibiotics and Roaccutane will reduce scarring because they're reducing the amount of harm that the spots that you have in the here and now will do. So all treatment, even topical tretinoin helps with acne scarring, and time, that great healer, will help with scarring. So there are lots of things out there. I think the most important thing if you're embarking on a proper course of treatment for scarring is to find someone who's got loads of experience and will tailor treatments according to your skin and not just offer you the only treatment that they have. They might have one type of laser, for instance, and then you'll get that type of laser, as opposed to having the full option of all 7 different types of treatments or whatever that might be suitable for you. So.
And I was talking to a patient about this today, in that things like lasers and chemical peels are completely user dependent. So the machine, although it does one particular thing, it's how you use the machine and it's how you use the peel and how you do that. They're completely user dependent. So actually you have to pick really, really carefully. And because these things are not that regulated, they can be offered in various different settings. And I'm not saying that one setting is necessarily more better than another, but they're very user dependent. So make sure you know what you're doing. And the other thing is, unfortunately, there's no option but to really systematically cycle through things and give things time. So make sure you're doing your regime for, cream regime for at least 6 months, and then go on to something else and give it time. Because I think often, you're so desperate to get things better that you flip from one thing to another, or it doesn't work, and actually there's no substitute for really, really systematically working through the options, and you'll get there. There are loads of ways.
So true. Strong therapeutic alliance, I think, is important in every aspect of acne management, whether it's the acute phase or the tidy up phase. Got to have someone helping you, drive the car in the right direction. That is, you have the same goals, with the same sort of time frame, that you really trust and have faith in. I think trust when it comes to acne management is so important.
Yeah, it's really important.
Right. What time of day is necessary for the use of sunscreen? I think all day. I mean, what we know is it's not just UV. We're worried about infrared these days. We're worried about visible light. My melasma patients, I tell to put sunscreen on even if they're staying indoors. So we know that UVA comes through glass. It's the same. We know that visible light can cause darkening of the skin if you're hyperpigmentation prone. So don't even think about when you have to keep it going. Just apply it in the morning, and if you're somewhere sunny and you're on holidays, keep it going until it's dark.
Yeah. The timing thing, so depending on how much you know about sunlight, there are lots and lots of different aspects of sunlight that come through. Now, this whole thing about time is basically based around UVB. So UVB is what burns you, is probably what contributes to a lot of your skin cancer risk, and that's highest between 11 and 3 and highest in the sunny months of the year. But actually everything else is fairly constant. So UVA, which is very important in aging, in the changes that happen to your skin, and probably partly in skin cancers, that happens throughout the day and throughout the year as well. There may be some minor variations, but there's significant amounts that happen. So actually, if you want to protect against some anti-aging and things, you need to be putting sunscreen on every day. And you need to make sure that you're aware and protecting against the environmental damage and pollution as well. We know that there's a huge amount of oxidation and damage that happens to your skin with pollution, so we need to be protecting against that with a synergistic sort of approach. So 2 products, something like an antioxidant like vitamin C plus a sunscreen. It's a wild old world out there. Dark
We're
and
so
grim.
pessimistic, aren't we? But no, we're looking out for you. Now, okay, we're going to have to wind it down shortly, but let's do last couple.
It's not a shame. We're just getting into it.
I know. I guess it's people finishing work, but we can do more of these. I use retinoids, azelaic acid, still having occasional breakouts. So I think a bit of benzoyl peroxide when needed might well just be the thing that keeps everything at bay. I tend to swap that with the azelaic acid. If things are very calm, azelaic acid is kind of a preventative route. Things start to break out more, I switched over to using benzoyl peroxide for a defined period of time until things calm down.
The other thing is, you don't mention which retinoid, is that right?
Yep.
So you can alter the strength of that if you're tolerating it really well. You can add a combination product in that's maybe got a little bit of anti-inflammatory antibiotic, which sometimes can make a difference. So there are nuances to these sorts of things which can make quite significant differences.
How can I remove blackheads? Simple answer, azelaic acid, retinoids. Those are my 2 go-tos for any sort of poor object, whether it's a blackhead or a whitehead. I know, they're hard.
They are hard, right? And particularly, I tell you, the ones
on the
that
side of the nose.
really hard is the ones around the side of the nose. And again, time. So people often will come in at So I think really common scenario, people, you give somebody a treatment plan, they come in at 3 months, they're like, oh, everything is so much better, but I've still got these blackheads around here. And I think often they're the last things to go. So you just keep going with that consistency.
And make sure you work plenty of product into the side of the nose. It's amazing how many people, they're really good with the flat surfaces, but they don't really consciously put product around the nose. And I think it's quite tolerant because it's got lots of sebum, which actually means that dryness doesn't tend to be too much of a problem. So make sure you're getting enough product on there to deliver the results that you're looking for. Now, Catherine, we've just covered the La Roche Posay cleanser situation. Do have a look at Instagram, but the one I'm going for at the minute is the Effaclar H Hydrating Cleansing Cream in its stead. And Boots have just started stocking it, actually.
Well done, Boots.
I know. How would you reapply sunscreen over makeup? Now, we've done videos on this. I think it's probably best. I just literally came back from holidays and I did a little video about what adaptations I make to my skincare routine post-beach or, you know, sunshine-related management of sunscreen if you want to look pulled together. What's your best tip for sunscreen reapplication if you're doing a city day look? I think if you're on the beach, it's simple. You just keep putting it on. But what do you do if it's a day like today in sunny London and it's like 25 degrees?
Compact.
Yeah.
I think part of the benefits of having freckly skin is you do quite well with various different colours. I use the compacts quite a lot because the colour thing works for me fine. Avène and La Roche Posay both do an SPF 50 mineral compact.
And Heliocare, actually.
And Heliocare as well. And you can top it up, and it's got a sponge, and it's not too messy, and it's got a mirror in it, and it's perfect for day-to-day use. The problem with the Avène and La Roche, I'm not aware of the Heliocare one so much, is that the colour...
a bit orangey, aren't they?
Yeah, it's not great. If you rock the orange look, like, I don't think I do, but I sometimes might do a bit of extra fake tan, then it works well, but it works for me.
I think, so for me, if I really, I mean, in general, I'm just like not out much during the day, a working day. I've got my sunscreen on in the morning and then I'll just be avoidant. So, you know, you'll catch me on the shady side of the street. I won't be sitting outdoors in a cafe at lunch. And I'm just, you know, I'm in the shade, I'm not in strong sunlight. If I had to do like a run or something outdoors at lunchtime that meant I couldn't avoid it, what I would do would be to work a tinted sunscreen as a base in the morning. I would put minimal cosmetic on my cheek or on top of that product basically, so that what it means is I can happily reapply a proper layer of a tinted sunscreen. For me, that would be the Neostrata Sheer Physical Protection SPF 50. So it means I've still got coverage in my skin, which for me, you know, wandering around London, I'm not going to be barefaced, it's just not me. But it means I've got coverage and I'm protected and I've got a fresh application of sunscreen on my skin to cover me through that strong UV exposure. And I've got my vitamin C on in the morning, so I've kind of got a belt and braces approach doing. I think that's what you have to do if you want to stay safe and you know you're going to get UV exposure during lunchtime.
Yeah, I mean, I think I'm like you as well. I don't really
avoid. You know, that's, people live in hot countries all year round, so you just have to make a conscious choice. If you care about this, you're going to take preventative measures and you'll carry a hat around with you. One of my patients told me about Scala hats. You know about Scala hats? So we're huge advocates of the global Babe brand, but Scala's maybe slightly more city orientated rim size, comes in lots of different colours, has UPF 50 rating. Okay, last question. Would you treat pink post-inflammatory change in the same way as brown hyperpigmentation?
No. Pink post-inflammatory change. So we're talking about post-inflammatory erythema from acne, is very, very common. Not necessarily. So a lot of that will fade with time. I find that most patients with that actually fades with time significantly. I think azelaic acid is very good for that. I think retinoids are good for that. And ultimately something like, if it's really not shifting, something like a pulsatile laser can be very helpful. So that's what I do with that.
Yeah, I think you're right. I think that in fairer skin types, if it's post-inflammatory marks, which usually are redder in colour, just because of the nature of their skin, they will often fade much more readily. Unfortunately, darker skin is prone to much more severe post-inflammatory hyperpigmentation. It can literally last for months to years. If, you know, particularly for nodules and cysts in acne, and they've been inflamed for a long time, the consequences will last significantly longer, and it's a real cause for concern and impaired quality of life and the rest of it. But I think that, you know, the key is prevention. Tackle the problem so you're not reacting to the consequences so much. And as I say, the good news is, particularly with acne, which is what we're talking about today, the treatments for acne will also tend to help with your post-inflammatory marks. Well, I think we have to draw this to an end. We could be here all night. It's been lovely, but 9 o'clock beckons. No, I'm kidding. But no, it's been really lovely. Thank you all for joining us.
Have a fabulous weekend.
Such clever, bright, wonderful questions. Now, I'm being asked if they can watch this live chat on YouTube. Celia, our lovely social media assistant here with it. Can we?
We'll upload later.
We're going to upload it somewhere later.
Lucky people.
So I think either YouTube or we'll do something on Instagram to let you know where this might be. I don't really know the ins and outs of it yet, but it might just be that it sits well here on the Facebook page. But thank you all for joining us. Let us know if you'd like us to do it again, and we
and topics
will.
As well.
And
We're always happy
topics.
to talk about skin, as you well know.
Bye for now.
Bye.